Hello, and welcome to When Life Gets Tough, a podcast that tackles timely and relevant mental health topics in an easy to understand way. I'm your host, Katie Curtis. Today we are talking about youth mental health and the impact that the COVID-19 pandemic has had on our young people. With me today is Sydney Carpintero, Youth Services Coordinator with Foundation 2 Crisis Services.
Hi, thanks for having me on the show.
We're so glad to have you, Sydney. So you and your team are working with youth on an everyday basis. What are some of the most common mental health concerns you're seeing right now?
Yeah, so right now we are seeing kiddos who are dealing with a wide variety of symptoms of their mental health diagnoses or just struggling in general with their mental health. We've got kids who are battling with anxiety and depression. They're having some really concerning thoughts of suicide. And just in general, we're seeing some really challenging behaviors, especially in our younger kiddos. This time of year particularly, I think, is hard for youth, and we're seeing a lot of difficulty kind of getting through that final push of the school year. Anxiety levels have been really high across the board for our kiddos, and getting them to stay engaged or stay focused at school while they're struggling with their mental health and feeling off balance has made for some pretty challenging moments at home for our families.
Sydney, I'm curious, are all youth in some capacity experiencing a mental health crisis or mental health symptoms? I just imagine because of the pandemic, we've all been kind of working through this for 2 years. Can you talk about, is it more prevalent with every student you're seeing?
Yeah, I would say a lot of our school calls and oftentimes our home calls too are just not even necessarily kids who are in what we would call kind of a heightened crisis. So crisis looks different for everyone, and I think kids are no different in that aspect, but we're definitely seeing just across the board all the kids that we meet with are struggling in some capacity, whether it's getting their schoolwork done or making it to school in the first place. Kiddos who just maybe aren't sure how to socialize with their friends or their peers, and they're feeling sad or depressed about those things, or they're feeling anxiety has been a huge thing for us the last couple of weeks. We've seen a huge spike in kids who are anxious about even going to school, attending their classes, going to games with their friends. They just are really struggling to figure out what is normal for them and how to maintain this level of life when the last 2 years have looked like chaos.
Sure. So, what does that anxiety look like? Like, how is that coming to you guys or being presented? Are kids coming out and saying, I feel anxious? I imagine it's presenting in behaviors. So what does that look like?
Yeah, it's different for every kid. We certainly have, especially our older kiddos who know to verbalize, I am feeling anxious. I am struggling with, A, B, and C. And in our younger kiddos, it's a lot more difficult to see. And a lot of times it comes out in some of those more verbally and sometimes physically aggressive behaviors. Our kids are irritable. They get asked a question and they don't know how to respond right away. And their instinct is just to kind of have a mini freak out about it. And I think our teachers and our parents don't always know what to do when we view kind of anger as like we've upset them and not as something is going on in their brain that is causing them to feel a little off focus. So a lot of what we're seeing is some of the verbal, something doesn't feel right, and then a lot of the, I think what parents would view as kind of acting out or, just kind of those things, especially at school, whether it's, we've had kids who are like pushing their friends who they're normally totally fine with because they have a minor disagreement, or kids who can no longer get up in front of their class and have, a conversation or a speech. Where before they probably were a little bit more inclined to just breathe through it and manage. And we're seeing that they're having a really hard time managing some of those normal behaviors. And it's coming out in a way that sometimes looks disrespectful to parents or teachers, but really is, they just don't know what else to do.
I think back to my experience working with youth, and sometimes anxiety would present in a physical capacity, right? So stomach aches or headaches.
Absolutely.
And I'm curious if that's happening in the schools, and, are we giving the schools the right tools to understand that might be what is happening?
Yeah, so especially at least in our program, we do have a couple of districts where we have school liaisons who are able to consult with our counselors, with our nurses. I know our school liaison for the Cedar Rapids district just had a meeting yesterday with the nursing staff in the district to talk about, what anxiety looks like physically. So a lot of kids do come in with, I have a stomach ache, and It's not always that they actually have, a physical stomachache, they're sick with the flu, but sometimes it just is anxiety is reacting that way. And I know even like for me, my anxiety really demonstrates in like get fidgety. So my legs start to bounce or I play with my hands a lot. Kind of those normal things that we look at that you sometimes just know that's like it's a little bit too much and maybe something's going on with them, but definitely seeing a lot of that physical symptom in kids who are anxious.
Yeah, that's a great transition. So, parents, I'm sure this is extremely overwhelming for parents of school age kids. What are the warning signs they should be looking for? The things that should make them kind of take pause and maybe seek a little extra support?
Yeah, I get asked this question a lot, and I always wish that my answer were a little bit more clear cut. The reality is that our kids are all facing some different challenges and unique experiences, and the best advice that we can usually give is to be on the lookout for what kind of differs from the norm for your own kids. And I know that's not a particularly helpful answer, and so I do have a couple of examples of what that might look like or how that might play out in everyday life for kiddos. So one of the first things that we kind of look at is their social functioning. Are they withdrawing from the family? Are they blowing off their friends and not going out and doing things? Are they spending like an abnormal amount of time alone in front of a screen? Those things are some good ones to look out for, just recognizing there's a difference in that pattern for them. Another big one is sleep. I think that comes for everyone, adults and kiddos, but are they getting too much sleep? Are they not sleeping enough? Sometimes a significant, differentiation in a sleep pattern is a good indicator that something might be going on for kiddos. And one of the last ones that I talk about too is just recognizing some difference in emotion. I think as adults, it's hard for us sometimes to recognize that, sometimes being irritable, we associate it just like teens are irritable. Sometimes they wake up and they're in a bad mood. But that's not always the most common thing, and it's important for us to kind of dig into it a little bit when we see heightened emotion or not enough emotion out of our kids. If there's a big difference for them, normally than what they kind of emote to you, it's a good indicator that it's probably time to check in with them and see, how things are going at school and at home.
Yeah, so again, leads me into my next question. So I noticed some things up. I noticed that something's off with my high school or my elementary school student. How do I start that conversation? What do I say? And making sure, to make sure that they're comfortable and feel like they have a safe space to talk.
The best advice I have for this one comes in a couple of different parts. And the first part is always just that you should enter into this conversation actually ready to talk about it. Kids are a little bit like bloodhounds. They can sniff out an uncomfortable conversation from a mile away. And so if they sense that that's about to happen for them, they will avoid it at all costs, if at all possible. So if you give them any indication that you're uncomfortable, they will tiptoe around it almost every time. So really just kind of coming in a little bit confidently, but gently with them. We don't want to scare them off in that conversation, but we also don't want to make it seem like we're nervous to talk to them about what they're going through. The next piece is always hard, I think, for adults because it's about listening more than you are talking. I think as we grow, we kind of get uncomfortable in silence, and the best thing that parents can do is start to get comfortable in the silence. We really have this pressure sometimes to fill awkward silences with our own voices, and a lot of times that actually discourages kids to talk because they know that you're just going to handle it. Everything is going to come from your side. And kids need more time to process what they want to say. Sometimes they're worried they're going to get in trouble, so they're really focusing on how they want to tell you things to make sure that they get the best outcome for themselves. So being patient with them and just letting them know that you'll be present until they're ready to talk to you. And kind of the biggest piece is we need to focus on the kids' point of view. As adults, we have different experiences and different processing levels, and we've lived a whole life of experience that kind of tells us how we should react to different situations, and kids don't have that. They only have a limited scope for what makes sense, and the emotion only needs to be real to them to actually be real, and sometimes we have trouble with those emotional situations because we have tendency to rationalize. When something is going wrong, we want to be solution focused and figure out immediately what's going on. And when kids are in kind of that emotional brain, they're not able to do that right away. So being willing to get on their level and talk about them at their experience kind of helps. And in our experience, at least in our world, kids really do want to talk about what's going on. Sometimes they're just not sure how. So it is up to us to kind of lead that conversation, provide some of our own experience so that kids don't think, we're the picture of stone-faced strength all the time and don't have any problems ourselves. It can be comforting for them to start talking about the way that they're feeling too.
Great. So let's say I sit down with my child. We have that open discussion where I'm able to ask honest questions and get honest answers. And as a result, I realize, wow, there's some pretty significant concerns here. Maybe there's concerns about suicide. Maybe there's concerns about self-harm. Maybe there's concerns about substance use. Well, then what? What's the next step if you're a parent who's had the courage to have this conversation, and now you're dealing with the next steps?
So the first thing to do is just listen to them until kind of they're done with that conversation. So don't try to rush while they're working through the things that they're talking with you about. Sometimes as soon as especially with suicide, as soon as we hear that word or as soon as we have that red flag moment of, they're talking about something really serious, we want to shut that conversation down and figure out immediately how to get help. And sometimes what we need to do is just let them finish sorting it out for themselves. And then kind of taking the next steps of, especially for older kiddos, thinking about maybe finding a counselor, someone who's going to be helpful for them moving forward and processing some of the things that they're going through. Medication's not for everyone, but if after a little bit you start to notice, things are not really improving, maybe you want to look into talking with your primary care physician first and seeing, is there something more going on at the biological level that we can figure out. And then our mobile crisis teams and our crisis line here at Foundation 2 are always available for kind of those consult moments. Our crisis counselors can help talk through some options on the phone of what the next steps are, and our mobile crisis team can come to you and help you through that conversation. We don't expect everyone to be an expert on how to do a risk assessment and talk with kiddos about suicide. We just hope that enough people know that those resources do exist and they can reach out to them to help guide them through that conversation and work through the next steps together.
Yeah, that I think will be my final question. So talking about suicide is extremely difficult and it can be hard to utter those words. So what's your advice to parents who need to ask about suicide to find out if suicide is a concern for their child?
Yeah, we say this every time we have this conversation, is that if you're having concerns that your child is thinking about suicide, we want you to ask them directly about it. No good comes from tiptoeing around the conversation. We need to be really clear that we are asking them if they are thinking about suicide, if they're having thoughts of ending their life. Because if we kind of mix the conversation of, are you thinking about harming yourself, is one of the ones we come across a lot that means something different to kids. So we need to be super clear that we are asking them, are you thinking about suicide? Are you having thoughts about ending your life? Because we need to know so that we can take the next steps. And it does get uncomfortable. And I always tell parents that when they want to have that conversation, they should stand in front of the mirror and practice saying the word suicide a couple of times. And I know it sounds really silly, but I think it's really helpful that if you can normalize that word so that it doesn't sound so awkward or so hard coming out of your own mouth, it really helps when you're addressing that conversation with kiddos directly.
Thank you so much, Sydney, for sharing your expertise with us today. We're so appreciative of your time.
Yeah, thanks for having me.
As always, if you or someone you know is in need of mental health support, the Foundation 2 Crisis Line is available for you 24/7 every single day of the year. All of our crisis services are free and confidential. You can call us today at 319-362-2174. Thanks for joining us today on When Life Gets Tough.